Liver transplant is the best treatment for patients suffering from end-stage liver disease. The important things for having a successful liver transplant are to have a patient in a condition when he can safely tolerate transplant. But most important thing is to have a donor who is healthy and as per Indian law has to be a family member who can donate part of the liver. But what happens in certain situations that there is no blood group compatible, that means a person who can donate a part of the liver to a person in the family who is having a same or a compatible blood group. In those situations, the patient does not have much of an option. In these kind of situations, what we do is something called a blood group mismatch or an ABO incompatible liver transplant, which helps us in saving many more lives in situations where there is no family member who can donate part of the liver and who has a blood group which matches that of the patient. So there is a patient which we are going to talk about. She was suffering from end-stage liver disease and was having a lot of symptoms because of liver disease and didn't have any blood group matching donor in the family. Only thing that could have saved her life was a liver transplant. There are 3 siblings who wanted to donate part of the liver, but none of them matched the blood group. So in this situation, what we suggested them to go for a blood group mismatch transplant or an ABO incompatible transplant. The patient's blood group was O. And what happens in patients with this blood group, they have an antibody against blood type A and blood type B. The sister who wanted to donate part of the liver had a blood type B. So what we do in these situations is we clear off all the antibodies against blood type B so that the blood type B donor can donate part of the liver for blood type O recipients. It's a complicated, technically very advanced procedure where we give certain injections to stop the production of antibodies, and then we use certain methods to clear off antibodies from the circulation, the blood circulation, so that when we implant the new liver, this new liver is not rejected by the pre-existing antibodies. And the entire procedure is known as immunoabsorption and monoclonal antibody injections. So this procedure takes around 2 weeks to prepare the patient for a blood group mismatch transplant. And after that, the transplant is done in a way which is done for a compatible transplant. And the overall success rate is almost same as the blood group matching transplant. The important thing is to identify the right kind of a patient and to do this treatment properly. The advantage of doing ABO incompatible transplant is when we evaluate patients in our clinics, 20% of the patients do not have a blood group matching donor. And in those situations, they have no other option but to die. With the progress of ABO incompatible transplant, we can save those lives. So we have been doing ABO incompatible transplants on a regular basis with a success rate as good as a blood group matching transplant. This patient, we did the ABO incompatible transplants after, as I said, preparing them with injections and immunoabsorption plasmapheresis. We achieved the target antibody levels, which was safe to implant the new liver. She underwent surgery and recovered well in 2 to 3 weeks after the transplant. Donor recovered within 7 days. For the donor, it is like a normal donation. There is no different treatment which the donor requires. And both of them doing well and are ready to travel back to their country very soon. I wish them all the best in their life.